When the whole world is faced with a pandemic like coronavirus disease, also known as COVID-19, all hands must be on deck to wage war against a dreaded disease. The African Academy of Languages, ACALAN, the African Union's specialized institution mandated to develop and promote African languages so that we can use them in all spheres of life in Africa, is of the view that we all must heed a clarion call by taking steps to contain coronavirus worldwide. So what is coronavirus disease, otherwise known as COVID-19? It is an infectious disease caused by the most recently discovered coronavirus. The new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. What are the symptoms of coronavirus disease? The most common symptoms are fever, tiredness, and dry cough. Some people may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some of the people become infected but don't exhibit any symptoms and don't feel unwell. They are asymptomatic. Roughly about 80% of people recover from the disease without needing special treatment. 1 out of every 6 people who gets coronavirus becomes seriously ill and has difficulty in breathing. Older people and those with underlying medical problems like high blood pressure, diabetes are more likely to be seriously affected. People who have cough and fever and are experiencing difficulty in breathing should seek medical attention. At this time, there are no vaccines for coronavirus. However, clinical trials are ongoing to evaluate potential treatments. The World Health Organization, WHO, and the African Centers for Disease Control and Prevention, Africa CDC, will continue to provide updates as soon as clinical findings become available. What can we do to protect ourselves against coronavirus disease? Start by washing your hands frequently with soap under running water. Do this for 20 seconds constantly. Regularly and thoroughly clean your hands with an alcohol-based hand sanitizer. Maintain social distancing by ensuring there is 1 meter between you and anyone. Also avoid touching your face, including your eyes, nose, and mouth with unwashed hands, because our hands touch many surfaces and can pick up viruses. Once the hand is contaminated, it can transfer the virus to your face, from where it will enter your body and lead to illness. Stay at home if you're feeling unwell. If you have a fever, cough, and are experiencing difficulty in breathing, seek medical attention and call in advance. Cough or sneeze into your inner elbow. Cover your nose and mouth when you cough or sneeze. Use a tissue paper which should be disposed of appropriately. Do not use your bare hands. Wear a nose mask if you have to step out of your home. You can also stop the spread of coronavirus by reducing social contact. There is no other time than now. Personal hygiene is key. Take these steps and stay safe. This message is from the African Academy of Languages, ACALAN.